Welcome to Sports Doc Talk. I'm Will Sanchez. Everyone, do not adjust your dials. That's our orthopedic surgeon and sports medicine specialist, Dr. Grant Garcia. Dr. Garcia, we're excited today. We have Michael McBrayer here, Senior VP of Global Business and Professional Relations at, say it, Enovis? Enovis? Are we saying it correctly here?
We'll see. We're going to get in trouble regardless. It doesn't matter.
I know. Michael's been at the forefront of innovation and embracing in sports medicine for decades, from his early work at DonJoy to his leadership role today. We're going to bring him on in a second. But first and foremost, Dr. Garcia, how are you?
I'm in some sadness with the neighbor's diagnosis of the ACL tear. Yeah. But the positives of Dart finally wins a game, and we actually look like a legitimate team. So,
yes, otherwise we're not here to talk about neighbors, okay? So we're going to kind of go through all that stuff. But when we're talking about recovery, we're talking about Mike B at the Recovery Shop. Let's give a shout out to the Recovery Shop. Dr. Garcia, tell us why the Recovery Shop works for you.
Yeah, so big thanks to our sponsors. You guys have seen this time and time again. And as our show grows, it's been great having them as sponsors. So again, for surgeons, post-operative recovery is important. People are always asking, like, what's the next level? Like, what can I do better? And they have the opportunities to have pretty much anything you want. That's sort of something that's out there. And we may even get into that today. We're going to see some maybe new innovative things and hear about the future of recovery from bracing, biologics, et cetera. I don't want to give away too much. But you may see some of this on the Recovery Shop in the near future as well. So this is pretty exciting. And again, you never know who we're going to have a guest on here. This started off as a sports surgery podcast. We have had some cool requests and just really been excited to have some awesome guests. And I think this one is going to be very exciting for everyone.
You know, and I thought Michael was going to cancel on us, especially after the results on Sunday when the lowly Giants got a win over his Chargers. He was still kind enough to come on. Let's see if he's still there. He may have left. Michael, thank you for joining us. Thank you for being a good sport. We appreciate the win because we get very few wins the last 5 years when it comes to the New York Giants. But welcome to Sports Doc Talk. Thank you for your time.
Well, thanks for having me. Number one, it is really hard to be a San Diego fan of sports. So, we just take that into account. Now they moved, so I don't even really care anymore. That's okay. I want to let your listeners know, and I really appreciate you guys letting me off last Monday. For you, I was really sick last Monday and still sound a little nasally, so bear with me. But I did want to thank you guys for letting me get a week to get healthy and try to do the show. So appreciate that.
No problem. We're looking forward to having you on. This will be great for our listeners. I wanted, before we jump into this, I think we want to make sure that we understand. Can you explain the difference? Obviously, you can see on both sides of me. I got DonJoy. Everyone, if you're anything orthopedic knows about DonJoy, it's DonJoy. And then pronounce the name for the listeners because I know we're going to mess it up again.
Enovis.
So our corporate entity and how we are traded on the New York Stock Exchange, the company is Enovis.
Enovis.
And, so we went. I'll take you guys through some history, but the public entity. So we went public again in April of basically 2.5 years ago. So, but Enovis is the umbrella entity that is, like I said, is our New York Stock Exchange way of trading our stock. But then the brands of DonJoy and Aircast live underneath that umbrella.
Okay. And then of those, did you tell us about kind of what you started off with, where you came from and your background there and how that kind of comes in full circle to now?
Yeah, thank you. So I can kind of tell the history of the company because I am part of the history of the company. I've been in December, it'll be 38 years.
Congratulations.
That I've been with the company. Yeah. Well, I don't know if it's congratulations, but it's been a great ride. The company DonJoy has a wonderful beginning. It started in 1978. So Mark Norquist was the offensive line captain for the Philadelphia Eagles. And that picture that you're seeing there was basically from 1978. So he would come back to Carlsbad, California, in the off season to play basketball. So he was as good a football player as he was a wonderful basketball player as well. And he came back with inner tube rubber on his knees and his elbows. The athletic trainer for the Philadelphia Eagles at that time was Moose Deddy. And Moose is the first individual to ever put inner tube rubber on people to warm their joints and keep the joint moving. So when he came back to play basketball, there just happened to be another little company here in Carlsbad called Body Glove. So making wetsuits. And Ken Reed, who was an attorney in town, and Mark thought that was a better material than inner tube rubber, and literally started cutting up wetsuits to make the products, make knee sleeves and elbow sleeves. They thought it was a good enough idea to create a company and needed to get some money to launch the company, and they leveraged their homes. So they had new loans on their homes. And in order to get their wives to sign on the new loans, they named the company after their wives. Donna Reed and Joy Nordquist.
Smart men. That was the smartest thing they could have done.
That's the smartest thing they could have done. Oh,
Will, you're muted.
Maybe it's better that Will's muted. I don't know.
No, I was just saying that, it's smart of them to, we're going to put the house up as collateral, but we'll name the product after you. So everything will be fine. So that must have went over quite well. But so did Moose is the inventor of what we know as the sleeve by him doing that way back when?
Correct. So they ended up creating a company called Pro. So, Dr. Garcia, I don't know if you know the company Pro.
I haven't heard of the company Pro, but I'm sure it's is it still around?
So it's sold mostly to athletic trainers and to training rooms.
Okay.
And Pro is still around. But
it's just not as big as DonJoy.
Yeah. Well, the reason DonJoy, the original products were sold to tennis shops. So it was not orthopedically driven to begin with. In fact, they signed Rod Laver to an endorsement deal. And Rod Laver, it wasn't a great endorsement deal because Rod would not wear the elbow sleeve in competition. He would wear it in practice. He loved the product, but he didn't want the competitor to think they were at an advantage. So he wouldn't wear it in competition.
Well, and we have that now with some other products. We have another podcast coming out with the product that some of the NBA players, they won't wear it during the game because of sponsorships too. Some of those things.
Right.
Exactly. I mean, obviously braces are a different animal. Can you pull up that other timeline? Can you describe to us kind of like DonJoy? What was you're talking about a lot about elbow. I think obviously a lot of things here are the knee braces. Why the knee? What was the kind of talk about the history again? We don't have to go too crazy on each version. Yeah. Why start with that? I mean, I can talk a lot about the knee stuff, but I think that you're obviously more important here. So,
no, not more important. It's just the fact that when they were trying to sell products into the tennis shops, at the end of the season, the tennis shops would send back the products because the season's over. So, like in the Northeast right now, in New York and places, those tennis shops are done. And so the only reason the company took a turn towards orthopedic is that they did have some accounts that physicians were buying these sleeves. And it's like, well, why don't we don't get product back from an orthopedic surgeon. And we get all these broken packages coming back from tennis shops. So it wasn't by like, hey, we need to be in orthopedics. It was just the fact that broken boxes were not coming back. And at this point in time in sports medicine, you had individuals like John Fagan and, Dr. Bergfeld from the Cleveland Clinic and Jack Houston down in Georgia. They didn't even know what an ACL was back then. They would reference it as a trick knee. And it was only about this time that they started understanding what the ACL did and that they should try to do something about that ACL. And that's why bracing got started. The company actually really took off on that. If you can see it where it says the super sport. And
yeah.
I was at a point in my career where sports medicine was so new, and these physicians that are now, part of the AOSSM, that's the Sports Medicine Society's Hall of Fame. They were really looking for, what can we do? What can we do for these patients? What, they want to get back to their sport. They want to, get back to the same level they were. And there were some pretty archaic procedures going on back then, extra-articular reconstructions and things that Dr. Houston used to do. So as the fortunate thing for me was the timing, because these people would see me. They would take time, effort, and consideration to actually teach me things and have me be involved in the discussion about how they were going to try to rehabilitate these individuals. And it was a very, very open conversation. It's a lot more difficult to get into, to see you today, right? As a single individual rep, it's like, how do I go in to, get to see Dr. Garcia? It's not easy. And it was just very fortunate at my time when you had Dr. Curlin and Dr. Jobe up in Los Angeles, and they were starting these fellowship programs. So there were a handful of these fellowship programs that I got to be involved in and meet those individuals that then created their own fellowship programs. So as you went to Rush and spent time with Dr. Cole,
Yes.
these become mentors and people that you will engage with, for the rest of your career. And that's how my career started, just because of the engagement with these individuals looking to try to help patients.
Yeah. And we don't want to jump ahead with other episodes coming up, but we're going to talk to people like that have been branching. It's amazing when you work with someone and we get experience as fellows. I think Will can hear this from people that I've talked to, some of my mentors who've even had on the show, right? When you show them something that you like, it spreads like wildfire, especially at the top places. I mean, Will, I've told you this before, the Jobe procedure is the UCL reconstruction. He invented it, right?
Yep.
He's talking about a guy that invented the Curl and Jobe Institute is one of the top fellowships in the country, right? And these are the two guys, Curl and Jobe. So, and
they treated me
names.
like I was somebody. They actually welcomed me in to their clinic. And, and that's what's sports medicine physicians on whole. Well, I may, get Dr. Garcia's head a little too big, but the sports medicine's physicians in whole, in orthopedics, are quite open to suggestion and quite open to saying, okay, what else can I do? What else can I learn from others? Whereas, and I don't, I'm going to profile some things with a broad brush. Spine surgeons, total joint surgeons, they don't have the same kind of approach to these patients. They have a hammer and nail, and they're going to use the hammer and nail, where a sports medicine surgeon, you're really trying to understand what that patient's trying to do and the approach. So I think sports medicine surgeons are, the animal that you want taking care of these kids.
Yeah. Well, it's also, I think the point you're bringing up is important, because I think Will sees it on these podcasts. Like, we talk about my patients. I had a patient today and I said, if you come to me in 10 years and I'm doing the same surgery, you should leave my office and go to somebody else, because I'm not doing the right thing.
Yeah.
So that's the way sports is. Like, we talk about this. Will and I are always looking about futuristic. We're going to get into futuristic questions here. This timeline doesn't exist unless you try to get better. And our patients expect that. I mean, as much as we talk about trying to be on the forefront, if you're in sports and you're in a big city like I am in Seattle, you cannot be behind. You just won't be able to be a busy physician, and patients want that. The internet now, ChatGPT, it tells you what you want. Patients want to hear. They come in already knowing what they want. You just got to hope that you're in the same page as them. In these cases, yeah, it's just the way it is. And everything you say is accurate.
I do find, the lay population, though, in some cases, doesn't understand the specialty. I even get it in my company. Somebody goes, hey, I'm getting my shoulder done by so-and-so. It's like, wow, I don't know that name. Where are they in practice? Yeah, well, he did my C-spine operation, and I'm going to let him do my shoulder. I said, no, you're not. I mean,
Even listen, Will's a doctor by this show, so he has his MD formula.
Exactly.
So he knows that seems
yeah,
unusual.
I could do the spine surgery if you want, if that's the case. If you're just going to say, well, you fixed my toe, so now fix my neck. So that's yeah, why not? So that it sounds like it's great advice that you're telling them. Yeah, I don't think that's the correct route for you to go.
So I guess let's go. So we talked about some of the bracing. So
sure.
I know we talked about this AOSSM. You got selected to the Circle of Honor. This is a big deal. I mean, it's on the internet. If you look up stuff, it's like the first thing comes up. It's a huge deal. For any of those listeners, AOSSM, I'm a member of it. It's got a huge membership. It's probably now, I actually would say it's better than AAOS in terms of meetings. It's probably one of the top, it's probably the top sports meeting. They work with AJSM, which is one of the top papers. This is the creme de la creme for sports medicine. So can you explain that a little bit more to the listeners to understand what this means for you to be recognized for this?
Yeah, well, thank you for bringing it up. And yes, AOSSM is, I think, the heartbeat of sports. It's the way that, again, the meetings, this is where all these physicians learn and et cetera. So to give recognition to individuals that are not physicians, so that's what the Circle of Honor was created for. Now, they probably should have given it to the company, not to me, in my name personally, because sports medicine is a team sport, and my team is my company's. So at the time it was DJO, so we probably should have given the Circle of Honor to DJO, and I could have accepted it. Michael Siccotti and Jim Bradley. Jim Bradley was the president in 2020. When they came up with the idea to give the awards. So they introduced and recognized 4 people in 2020. The 4 people were Ken Langone, Stanley Druckenmiller, Reinhold Schmedling, and myself.
Will,
now,
that's
those
the CEO of
listeners,
Arthrex.
Yeah.
Yes, and so Reinhold is the owner and operator of Arthrex, which is a huge company. Those other 2 names, and he himself, all 3 of those are billionaires. I am not. I don't know how I missed out on that. But
I thought that came with the award. You got that with the award, right?
It wasn't a check.
Well, I'm going back to AOSSM and ask for it then, if that's the case.
We'll back you up on that.
I
I
appreciate
know you're
that.
being really humble here, but I think what Dr. Garcia is like, what does it mean for you personally, professionally, for you to have this award with this distinction that comes from the people that you've worked with for so many years? I mean, you may not be the billionaire, but this is an amazing award. So let's. I know you're giving kudos to your team and everyone else, but just personally, what does this mean to you, as far as impactful? And you go home to the wife and going, I can't believe I got recognized like this.
Yeah, that's so. The distinction is it was a very impactful piece to me. So like I said, in 2020. We did it doing it via Zoom, and Dr. Bradley, I've known, maybe since he started his fellowship, maybe just at. Michael Siccotti was a Curl and Job. Both of those are Curl and Job fellows. So not only do I have a personal and professional relationship with these individuals, we've become friends, and friendships, kind of go deeper than just a transaction in business. And I feel that they understood what my impact has been related to helping and creating opportunities for education, because the Sports Society is really dedicated to education. And I've been very engaged in the traveling fellowship program for AOSSM. I've helped establish other traveling fellowship programs for Foot and Ankle Society, for the American Medical Society for Sports Medicine, for Sports PT, because I know the interactions that happen with these. So a traveling fellow, there's 3 that are chosen, and they choose a senior individual that go to Europe, South America, or Asia. In fact, the last traveling fellowship for AOSSM just got back from Asia.
Yeah.
But these are life-changing experiences. And we as a company support those programs because we know what the benefit is. I mentioned a name earlier, John Fagan, who was at Duke. He's the one who came up with this idea of a traveling fellowship years ago. And Aircast company at the time was funding it. And we made the acquisition of Aircast. And John was concerned whether or not we were going to continue to fund it. And Dr. Fagan was a West Point guy. He's deceased, but he was a West Point guy. And I knew when this conversation was going to have to be serious with Dr. Fagan because he would call me McBrayer. He says, "Hey, McBrayer, I need to talk to you about this traveling fellowship." And I knew the conversation was going to be casual if he called me Michael. So he goes, "McBrayer, hey, what are we going to be doing about this traveling fellowship?" I said, "Well, not only did we acquire a wonderful company called Aircast, but one of the nice pieces that added to that is that we will continue and be a part of the traveling fellowship." And he says, "Michael, that's a good idea."
So then, see, you got on his good side. See, I'm going to call it's Sanchez and Garcia, or it's Will and Grant. So we'll now know how we can talk to each other differently.
Now
exactly.
Now, whether
you guys will see that's going to be the new hint on the podcast. Everyone's going to be expecting to see how's their mood today. This is great. So can you talk? So again, one of the big things we want to go into the larger company, but I think the DonJoy is important. Can you kind of talk about some, briefly about the science about how the bracing has shifted over the last, 10, 15 years? Again, history is great. But our listeners, they obviously like cutting edge stuff, right? They're going to want to know, like, where are we going with this? The orthopedic surgeons listening, they've heard your name, right? They've heard DonJoy. They know all this stuff. But for the listeners who are looking at these products, what does it mean for you guys? How have you guys shifted your mentality for the bracing that you're doing?
Yeah, and so knee bracing is just a portion of it now, right? I mean, so when early on we wanted to prove that braces were actually doing something for these ACL reconstructions, we did research at the University of Vermont. And it was very cutting edge at the time. It's been a few years ago now, but we were putting strain gauges on the intact ACL. So we did cadaver work initially. We were showing that we were strain relieving, getting strain off of that ACL with our brace. And then somehow we got some volunteers to have a strain gauge put on their ACL, intact ACL, and then put loads on their limb. And we showed that we can, yeah, exactly. I'm still
you wouldn't be able to get that IRB approval anymore. That's impressive.
That IRB would never get approved again, ever. And I don't know if you want to explain what an IRB is, but it's
Will, it means that the institution would approve someone to put an implant in someone's knee without actually needing the surgery.
Exactly. So as a portion of how we've looked at and tried to confirm that our products are doing what they say, we do these pieces of research. We've also done economic studies. So like when you see the college football teams, we only have one Division I school that's not in our knee brace. The rest of them are in DonJoys. And we've done some, there it is right there. And so the down linemen that are looking to be protected because they get their own player to roll up on them. So they're not, these are contact injuries, not non-contact injuries, which a brace can be very, very effective for. And we did a study at University of South Carolina looking at just the economics of, okay, you've purchased these braces, how many ACLs did you have and what was the cost of that ACL? It's devastating to the player, but from an economic standpoint, we wanted to prove what the benefit was.
It's important. Can you tell, I mean, it's important, Will, I think that bring this point up. We talked about the cost of injuries. You brought it up on the last show that we just had. We've talked about it before. Yep. It's devastating, right? And we talked about this, which we will hope, I think the podcast just came out, on how long does it take to get back and what is the benefit of doing these things. It's really important. As much as everyone says, we don't want to talk about the cost of something. That actually is really important. Like, is it worth spending the money to get a brace? Correct. If it's not going to help you, right? If it looks nice, that's great. But so for your guys' bracing, you guys have looked at ACL. I'm assuming, MCL and other ligaments. Is the ACL the big one you guys have focused on? It's obviously the biggest one. I mean, we just talked about a player of ours that we're dealing with the ACL tear situation, but in general, is that your major one you look at, or what other things have you guys looked at or thought about in terms of the brace, like what you guys do from that?
So I'm gonna shift gears a little bit, because ACLs is a big segment of our business. But when you talk about the sheer number of injuries, foot and ankle, total number of injuries is significantly higher in the total of, sprained ankles and et cetera, et cetera. So when you start looking at the total number of joints and injuries, ankle is the number one joint for some kind of injury. And so these same thing, whether or not we're trying to, as a company, Enovis is quite different than any other orthopedic company, because we look at the patient from trying to prevent injury to post-injury to operative care and post-operative care. And there's no other orthopedic company that does that. The big companies, Stryker and Zimmer and big companies like that, only are working on that patient when they're asleep, in the OR. And so we think we have a unique approach to trying to this, what we call a continuum of care. So any joint in the body, so foot and ankle is a huge one, because there was a player on the Dallas Cowboys last night, I won't name his name, but he had our walker on. He's on the sideline. I noticed it, probably no one else did. And then you talk about, there's a surgeon that, and most of these ideas and things come from surgeons. The surgeons are looking for these ways of trying to take care of patients. Physician up in Los Angeles, Steve Snyder, if you ever met Steve, Dr. Garcia. Steve Snyder, shoulder surgeon, was the first one to start putting people in a post-operative pillow to position themselves and take strain off of the reconstruction for their shoulder. And so it's what I'm most excited about this as a company, and continuing to work for another 38 years or whatever it's going to be, is the innovation that's coming from the surgeons. When they see a problem and they're not satisfied with what they're trying to do for that patient, they raise their hand and they reach out and say, "Hey, I have an idea," or "Boy, have you guys thought about this?" It's that's going to continue. That's not going to change, that I can see, certainly for sports medicine surgeons.
Yeah, I mean, I think that's an important point. We've talked about this before, Will, but the innovation is a collaborative effort, as you mentioned, right? It's not only how do we see the problem, finding a company to work with, and finding the right people to work with from both parties, right? For the company's party, and then finding the surgeon the best fit, and then finding a problem that actually works, and then looking at the science behind it. It's all really important. We've talked about this from the from the napkin to reality, like one of our first episodes, how you take an idea. It's a lot. And again, what's different though, I think, which you could bring this up, is from the bracing standpoint, the innovation is still a pretty strong, long period, but it's a little bit faster, right? You don't need the same regulatory stuff as you would with like a biologic or something else. So you guys can have ideas to, I mean, what would you say? This is interesting for the listeners. And actually, I just think for all of us to hear, what do you think? Like, let's say I came to you with a great idea, right? And it's something that we kind of just knew. You got to test the water, see if there's any patents or other things out there. But let's say it's a good idea. It's a workable idea. What is kind of the timeline for you guys to kind of put a product out like that, roughly?
So it's a great question, because we do get the napkins occasionally, the napkin to a product. We get individuals who have fully blown prototypes and have worked on their IP, et cetera. So you have that spectrum that you just described. So the napkin to something could be, like a 3-year project to get it all through. Our requirements. So these devices are what we call Class 1 devices, and Class 1 devices do not have very large hurdles to get over in order from an FDA standpoint. So we don't have those kind of requirements that implants have for bracing. So obviously our implants for foot and ankle and our surgical total hips, total knees, total shoulders all have those requirements. And those, like you said, take longer term because of some of those requirements. But it's still an arduous mechanism to try to get something that's a manufacturable, reproducible, economic product that you can launch and have an impact in the marketplace.
Michael, are you seeing, or have you seen in the last 12 months, 6 months, 3 months, an uptick of ideas now that everyone has access to AI, right? Where they can pop in ideas and come up with things. And so are you seeing anything like that futuristic that's kind of going across your table, or maybe the table of others in the company?
No. No, there hasn't been an influx of new ideas. Now so AI for us as a company on the bracing side, we haven't really made much progress with it in the standpoint of creating manufacturing product. Okay. Where the implant or the importance for AI has been for us is we have a software package and program that runs DME. DME is durable medical equipment. So all the braces and supports that are in a physician's clinic can be insurance billed. So if you went in to see Dr. Garcia and he says you need a walking boot, or you need an elbow brace, or whatever the case is, those products have a billable code that then insurance companies will reimburse that patient for those items. But it has to be done properly. It has to be coded properly. The inventory has to be done. So this, what we call Motion MD, is this operative software system that gives information to the clinic. We run clinics for that as well, but it's complicated business. It used to be the practice of medicine. Now it's the business of medicine, right? You used to be able to not worry about whether you build something properly or you gave product away or something, and you can't do that anymore. So this product, what I call a product, but it's just a software that you can get the patient's insurance in real time. Medicare and these entities are making requirements. There's a thing called same and similar. So if you had a product 4 years ago and Dr. Garcia decided that he wanted to prescribe that, didn't know that patient had already had a product similar to that Medicare would call that fraud. So it's pretty scary. So we have the same and similar. We can quickly check for the patient to see if they had something like that. So it's operationally, we're using AI from the standpoint of how we react, work with a clinic and a group. We haven't used it much in what I call product development yet.
I think that's a good point, Will. I think the thing we keep thinking about is we still think AI is so smart that you're going to be like, hey, give me the next bracing idea and we're going to put it out. The problem is, I think right now, we talked about this on our AI and medicine episode we did a few months ago, but it really, right now, it's just not smart enough to come up with that level of whatever. And then, okay, by the way, we need to do this. It's multiple levels of steps, right? I see a problem. How do we fix the problem? What is the problem? What's a realistic problem before you even come to a company like this to show that? And we've already, I know this because I work with a bunch of different companies on different product design things. And you think you have such a good idea. You spent years of planning, prepping, thinking about it. And then you send it out and it's like, yo, dude, that's like, we've done that like 7 times. Like, that's not the idea. So, and then it's more like, I guess AI can throw more things at the window till they get the right one. Right. But it's not so straightforward, and the commands you need for that. So I think Will so this from when we did our episode is that a lot of times this AI really is just, how does it make your things more efficient and not make mistakes? And within insurance companies, how do we improve our efficiency to get our things approved and make sure we follow all the rules? Because really, no one here is here for any fraud or any other attempts in medicine. All we want to do is make sure the patients get what they want, and our barrier is insurance, and we need to make sure we do that appropriately. So,
but they make it complicated.
Oh yeah, I know. I have a lot of fun with
have the
that
best intentions. Yeah. So the intentions are not, I agree with you. Nobody's sitting out there going, hey, I wonder how much I can get out of an insurance company. You're just trying to stay on the road, keep on the guardrails, and go about your business. And that's what this software can do.
Can you talk about some of the, I guess this is important. There's two parts. I think the first part is we've talked about 3D. We're going to talk about 3D printing, I think, in the near future for an episode. It may come actually out before this episode, but we have to see. But how is 3D printing, is any part of that part of your scale or where you guys are going in the future?
So we made a recent acquisition, Lima, which is a surgical company in Italy. We actually house a 3D printing segment at HSS in New York City, but it's for surgical implants. Our experience for 3D printing on the bracing side has been that it's a very expensive mechanism to create something that we make with different materials already. So so far, the expense of 3D printing has not allowed us to do it on the bracing side. We are, as I said, working with it as a surgical implant product.
Cool. Yeah, that's a great segue. That's perfect. So go to bracing. I kind of want to get into the major company itself too in a second. But I really want to know, we talked about the surgeons. Do you guys how do you guys work with, like, you have the athlete, right? You have that initial start, right? The guy wore the sleeve, doesn't want to show it in the games because he doesn't want to have his things. And now it's all about branding. I mean, we've talked to a few companies, which we can go into later, but that have said that, like, they have a lot of trouble. Some of the athletes wanting to, I mean, in the NFL and those things, sometimes wearing bracing, you can't, right? You just,
correct.
You can't wear the elbow brace. You can't, in some cases. What barriers have you had from it for athletic adoption of these braces, if it was allowed? So, like, we saw Thibodeau for the Giants, he wears an elbow brace, like that's allowed, right? So there's certain things that are allowed,
but they don't have the brand on.
Okay, got it. So that's important. So no branding.
So the equipment manager, at least in the NFL world, is responsible for what they call uniform infractions.
Yep.
And we get away with a couple. Not going to tell you how. No, I'm kidding. But they're serious. I mean, like, if the quarterback, when he goes to the sideline, doesn't wear the right hat, the NFL says you didn't wear the right hat. All of our braces, so you're not supposed to show the DonJoy brand because we put it on the calf cuff of a brace, knee brace. We have these wrist wraps that a lot of players wear and has DonJoy on it. They'll typically tape over that. So that the NFL is the no fun league, if you want to call it. They're very critical because they know if we wanted to get a sponsorship from them, and we could approach the NFL and say, hey, we want to be the knee brace of the NFL, and it costs a significant amount of money, and we just don't see the patients are not making a choice. They're following their doctor's orders. So it's not like they're going to the store trying to find a DonJoy knee brace. So we haven't done anything like that from what I would call a commercial standpoint.
Except I would second to you on that one. I do have patients asking for a DonJoy, even though it is not but you know what I mean? People ask for these braces. Will, I don't know if you've ever heard the name, but people ask for, I don't want to bring up your competitors, but I have, they ask about the competitors and they just say, I want this Predator. I'm like, but you don't even know what that means. They're like, I've heard the name, so I want the DonJoy. But there's like, you guys have probably, I mean, how many different braces do you think you have even for the knee?
Oh my gosh. Too many, quite honestly.
So when someone asks for a DonJoy, they don't really know what they're asking for.
They have no idea.
I want a car. I want a Mercedes.
Jordans.
Yeah, well, because we have osteoarthritic knee braces, we have patellofemoral knee braces, we have, so all these. In fact, Dr. Cole actually helped us with our OA Rome brace. So yeah, you're right. They have no idea what they're talking about.
Yeah. So I want to pivot, even though I love the bracing, we could always come back to it, but we also have in a matter of time, we always do this, but it's 60 minutes. We have to cut it off because it's just because of the way social media.
Oh, I'll be tired of you guys by then, for sure.
I'm tired of you guys right now.
So can you talk about the other companies you guys work with
Yeah.
because I think the biologic one is going to be hot. Like, what companies do you have from the biologic standpoint, and how does that influence, the other sports medicine realms?
So we haven't entered the biologic space yet. So the areas of the company that we haven't, if you want to call it musculoskeletal care, we don't have anything surgical in spine. We don't have what you would reference surgical sports medicine. So those are big segments for Enovis to consider to try to enter as a market, because they're large, they're growing. Our largest growing segment is our foot and ankle surgical business, and we put that together through acquisitions. So multiple acquisitions now has made that $100 million surgical foot and ankle business. And I profiled sports medicine surgeons as the darlings. Foot and ankle surgeons are good people too. They kind of have the same profile of approach to patients and such. Our total joint business, total hips, total knees, and total shoulders, is very, very small in comparison to the large competitors. Where we do compete quite well is in the total shoulders. Reverse total shoulders being the probably the biggest competitive piece that we have, and a surgical intervention that's quite successful, right?
How do you find that integrates well with the bracing side of things? Like, I mean, again, the company's got multiple brands to it, right? You guys have talked about, you do. I want to talk about this electrotherapy, some of the other equipment stuff you do on side of the braces in a minute. But how does your company having reconstructive implants, for hips, knee, and obviously biggest is shoulder. I've heard about the shoulder for sure, and a lot of the other ones, but Enovis for the shoulder is important. How does that help integrate with the bracing? How does that make you guys better?
Yeah. So again, if we take this continuum of care approach, so you may or may not be familiar with the No Pain Act.
It's a little bit. I mean, I think I get too many emails about it. I can't imagine that. I'm not gonna say I read them all.
Yeah.
But
Michael, can you explain that, because I am not aware of that.
Yeah. So
the
the No Pain Act was a recent act by the Congress and Senate to pass to include mechanisms for reducing opioid use post-operative care. So they were looking for products that would be would reduce opioid use and be safe and effective. Well, cold therapy, motorized cold therapy, has been a very, very effective product. And there used to be a billing code. You guys are wonderful with your little flash up there. Good job. But cold therapy had a code that people were billing, but it was abusive. They were billing it improperly, and so Medicare just stopped reimbursing for cold therapy 20 years ago. Even though it's a very, very effective mechanism for post-operative pain. So through the No Pain Act, we've been going through a comment period. We're supposed to hear quite soon whether or not this Iceman device is going to be approved by Medicare to be reimbursed. So, Dr. DC, when you were saying, how does this happen now? Okay, I have a total shoulder surgeon, or I have a total knee surgeon. So now we say, even though they're two different entities, the divisions are different, but we can introduce the cold therapy now to take care of this opioid issue and pain relief as one entity, right? We're going to come to you and say, hey, we know you use our shoulder. This No Pain Act now gives us an opportunity to take care of your patient with a reimbursed cold therapy device. And so that's where that connection can come.
Gotcha. Thank you.
And also, I think the thing you bring up was like a lot of you said, we keep talking about these cold therapies. They're not covered by insurance because it's just, even though I will tell you, and this, and we don't need to go into different products that we use, but the cold therapy situation, it makes a huge difference. I will tell you that is not just anecdotal. It is, I don't know enough about the data on cold therapy, and I wish I did. But I can't imagine, I think Will say the same, that cold therapy is not does not reduce opioid use. It's just, I mean, I'm sure it does, but I'm just, I can't believe there's not more things. The problem you have, obviously, with all these studies, postoperative pain, is that, you know, all surgeries eventually stop hurting, hopefully, if they're done well. And it doesn't usually take that long. So it's hard to capture that data, right? Like 2 or 3 days less pain.
Pain studies, period, are difficult to do. The one study that that was recently done, I don't know if you know the name Sarah Edwards at University of California, San Francisco. So look for her recent research that we think her paper was the thing that crossed the barrier from Medicare to get it reimbursed. So that study was paramount to our approach in getting it approved.
Was that a post-surgery study? A post-surgery recovery and rehab study?
So it's so Sarah Edwards, like I said, is at the University of California, San Francisco. The paper, I'm trying to remember where so she's presented already, and it's been accepted in one of the journals. I don't know if it's the Anna Journal, but you'll find it.
Yeah, I mean, again, the key here is just
the abstract.
We want to show, we want to show basically the key is for patients to hear this is like, it does make a difference. Opioid reduction is very important. It's now tied to insurance reimbursements. And again, it's just, again, hopefully it all comes down the same line. Can you talk about, now, do you have any, like, how does this sort of, I know I have the list of the brand portfolios that you guys work with, and I'm interested in each one of these things. How does the rehab, so you talk about this, you have all the lines, right? You have the surgery, you have the pre-surgery, you have the post-surgery, you have going towards potential long-term biologics, things like that. How does the electrotherapy and the rehab sort of side of things help with your stuff? I mean, I kind of know where it's going, but what are your thoughts? Like, how does that go?
So some of the recent product enhancements. So laser therapy and shockwave therapy, both are very effective and can take care of tendinopathies. So when patients come to you with a tendinopathy issue, so like, the Achilles flaring up, not a tear, right? Tennis elbow, golfer's elbow, whatever, all these little tendon issues are non-operative issues for an orthopedic surgeon. And you don't want a lot of those people coming into your office because you're a surgeon and you want to do surgery. So
I'm not going to deny you. I'm not going to deny you.
You're called a surgeon for a reason. But when I mentioned the American Medical Society for Sports Medicine, these are fellowship trained primary care, sports trained individuals. And so they can take care of non-operative issues in using laser, using shockwave and mechanisms for these patients to, again, get back to the level of what they were trying to do without getting cut on, so to speak. So that whole spectrum for primary care sports, as well as physical therapists, sports physical therapists, the PT networks and there's the specialty of sports physical therapists that know how to take care of these patients, again, potentially non-operatively. And then, every good orthopedic surgeon has their favorite physical therapist to take care of their patient after they do an operation as well.
Yeah. Well, I think that's great. I think that I don't want to segue too much in that, Will, but that obviously the laser therapy and the shockwave therapy is humongous. It's humongous for tendinopathies, but also the laser for post-operative, which a lot of but also as an orthopedic surgeon, you're entrepreneurial, business minded. A lot of us, I'm private practice. So you always look at how to way to keep the patients, to make sure you have every level for them to take care of it. So, a lot of people use the laser therapy preoperatively and also sometimes postoperatively for wounds, et cetera, and pain control. And there's been some AOS data on that, which we won't go into too much today. But that's a really important part you brought up. So again, keep going.
No, I was just going to say, and those types of procedures are, unfortunately today, at least, those are things you have to talk to the patient about paying cash for.
But
So
as we know, in this day and age, there are patients that want to pay that, which we've talked about it
absolutely.
before. And the thing is, I would rather my patient be offered at a cash option than nothing. So at this point, it's not like I always tell that to the patients. I think, Will, this is obviously a topic we talk about. We've talked about it with the recovery shop I brought up.
Yep.
A lot of things aren't covered by insurance, but patients want more. I know I'd be in the same boat. I know a lot of us would be in the same boat. We all know that, like, if we want, as much as the surgery is covered by insurance and it's a huge financial burden and it covers, you don't want a problem with it. And so sometimes the little extra things to reduce those things are a big deal, and people are willing to do it, especially if it's not covered by insurance. Again, my whole goal, as we talk about before, and you talk about this, is get as much as you can from the insurance company to approve. And if you want
Correct.
something extra, here are the options, here are the risks and benefits. And again, the goal is to make it, you're not going to break you don't want to break the bank. You just want to offer something that you think is going to be helpful to them. And we all know that insurance is 10 years behind what we're doing, if not more, in terms of the options that they can give the patients. It's just, I mean, sports medicine, we know this all the time. I have this on a daily basis with, talked about recently, the fertilized ACL, right? Insurance won't pay for it, but there's good data on it. And we just talked about it with Chad Lavender. So this is important stuff to talk about. I don't want
Well,
to
I think it's,
labor it.
well, I think
But
it's
keep
what
going.
I reference it now as the consumerism of medicine. So now an educated consumer can make a choice about their care. And, you know, in the past, I've just, well, my insurance is going to take care of it. And so having an intelligent choice and having them be a consumer of this kinds of things, I think is good for everybody.
I think one more question, then we'll do kind of a wrap up future question. Do you guys
Oh
deal
boy.
with pediatric? No, it's hopefully easy for you because you've done this for so long. You know this. So the pediatric bracing, do you guys deal with that? And is that a different level of what you have to, is it anything different for you, or is it just part of the same envelope?
Yeah, so we've been treating it in the same envelope, and we shouldn't. Pediatric injuries and pediatric patients are not small adults. They're different, and we as a company need to make an effort related to changing our thoughts and how we approach these injuries and these types of patients. The pediatric sports medicine specialist is now a thing. You have organizations that are strictly focused on pediatric sports medicine, POSNA, as an organization. So, you know, people are doing a sports fellowship and then doing a specific pediatric sports fellowship. And so the number of these individuals is growing. So the fact that that specialty is growing, we as a company have to listen and start approaching these patients differently than what we, and then just making an extra small. That's not going to get the job done.
I brought this up before on the show, and Will knows this, but we've come along in sports medicine, which is, whether you want to say it's good or bad, but we've had to become more aggressive with pediatric patients, because it used to be the thing like, dislocate your patella as many times as you want, you're fine. Dislocate your knee as much as you want, you're fine. Dislocate your shoulder. And I mean, there are a number of papers coming out that even first dislocation is not okay.
Correct.
Second
I
dislocation,
agree.
not okay. And so as a result, this is a really important point, because that's why you have more surgeries, more people being involved in pediatric, because we realize that if I can, that's the whole point of joint preservation. Like, I just saw a 16-year-old girl today dislocated her kneecap and broke off a piece of cartilage. Like, some people might have just left it alone for another 10 years and waited till she had a lot of pain, but we're going to actually take care of it, because I know that that's not going to be good in 10 years. I know that's not going to be good in 20 years if we don't intervene. And we've learned that,
agreed.
Right? It's the same situation.
I completely
agree. What
agree.
you're talking about. I guess we'll probably ask any closing questions, but where do you see the kind of, I know the company itself, where do you see the future of DonJoy going, and where do you see the future of the company going?
And the future I referenced earlier is these physicians are going to continue to make us change and do things. So that collaboration, which we have a reasonable reputation, that people who approach us because we have we've done things with surgeons and reputable surgeons, and people know that we will at least listen and try to do some things. It may not turn into a product, but the innovation and needs for, uh-oh, did you guys leave?
No, we're still here. We hear you.
Oh, good.
We're here.
My screen just went blank.
I
Well,
think your screen-
you still look good.
item.
You got it going. Keep going. Sorry.
The collaboration between surgeons who are going to want to try to continue to take care of their patients and companies, not just Enovis, is still the most exciting thing for me to be involved in.
Awesome.
Michael, thank you so much for your candor and really honest answers. I mean, it was a privilege hearing about your journey, the vision for the future, not only the company but sports medicine, and it's just we really appreciate your time. We're glad you're feeling better. Tell Christina I hope her Dolphins are doing well from all of us. And once again, thank you so much for your time. We'll let you go. I know it's late out there on the East Coast.
Oh, no, I'm in California, brother. I'm all good.
Oh, sorry,
I'm in
Christina. Go to
Carlsbad.
bed. It's late for Christina. Thank you so
Hey,
much.
guys, I enjoyed it. It was a nice experience. I appreciate your time.
Thank you, Michael.
Thank you.
Take care.